All right. Good evening. Hopefully, our internet holds up for this. It's not looking too promising at the moment, so we apologize if there's any technical issues out there with viewing this. But today's video is regarding reducing healthcare costs in retirement. If, like, when I watch YouTube right now, I see tons of content regarding retirement for people in our age range, whether it's planning for retirement, early retirement. There's tons of stuff on there that I watch, like uh, full-time RVing, van life, international slow travel, the fire movement, people retiring on a boat and floating around the Caribbean, which sounds fantastic right now. And I am very, very eagerly awaiting the concept of early retirement, at least for myself. And then one of the topics in that is healthcare. And people talk about, like, well, what are you going to do until how are you going to plan for your healthcare until you reach like Medicare age? Or if you're international, what are your healthcare plans going to be? And so that's why I wanted to talk about how you could reduce healthcare costs in retirement, because in the little bit of research I've done, it's going to be in one of your top 5 costs. It can be 1, 2, or 3, or 5, whatever, kind of depending on a bunch of different factors. But housing, taxes, and healthcare costs are the top 3. So I think it's an important topic to think about.
So why did we put on our thumbnail that Gen X is at risk?
Well, one, because we're Gen X, and so what's important to us is important to everyone, I guess, right? And that's I think our audience, right? We're talking to Gen X people, but the real reason is this: if you consult the Book of Knowledge and go to Google and just put in there, just put in Generation X health issues. Just Google search that, and I'm going to just quickly go through here and give you some of the top topics that pop up with that. All right, ready? Ohio State News. Health declining in Gen X, national study shows. All right. Gen X faces more years of ill health than baby boomers. That doesn't sound good. Gen X has higher cancer rates than baby boomers. Gen X cancer rates projected to outpace boomers. Talking about the generations, Gen X may face higher cancer rate than boomers. We, Gen X, face higher risk of 17 cancers than older people. And then Gen X health problems due to chronic disease. So there's a lot of stuff that we might be looking at in retirement. So we're a generation that's literally thinking about retirement now, and a lot of us are thinking about retiring early. A top cost is going to be healthcare, and we're facing all of these potential healthcare related issues. So I think it's important, like, how are we going to be? You can control the cost of housing. There's ways to plan for that. And you can control your taxes. There's a way to plan for that. So how do we plan for our healthcare costs, and what can we do about it? And you put together some of the a little more details on what things might cost if some of these things affect you.
Mm-hmm. Yes. So if in the United States, the average healthcare costs for a healthy retired couple is $13,000 per year.
Okay.
So that's for the couple.
Right.
Now, let's start adding different comorbidities or morbidities along with that. Now you're talking about diabetes. You add diabetes to that, and per person per year, it's over $20,000.
So for a couple, 40 grand. If
Yes.
they both have diabetes.
If you both have diabetes, you're talking about $40,000 just for diabetes.
Okay.
So for cancer, per person per year.
And we're at more risk according to the Book of Knowledge.
Yep. 30,000. Dementia, 48,000.
Okay.
Almost $49,000 per person per year.
Wow.
And then for heart failure, you're talking about another 30,000 per person per year. And then if you have kidney failure or non-dialysis,
like kidney disease,
yeah, then you're talking about $14,000. But if you get to the point where you need dialysis, you're talking about $57,000 per person per year. And now add that. What if you have diabetes?
Yeah.
And heart failure.
Okay.
A lot of these things go hand in hand.
Right.
So think about that. So let's just say that I have diabetes.
Yep.
And heart failure.
Correct.
You're talking about more than $50,000 for just me
Right.
per year.
Someone with and I can just tell you my experience from the emergency department. Someone with diabetes and heart failure would have some stage of kidney disease too. So maybe not quite on dialysis, but you're going to add that on there too.
Yeah, add
it's gonna
another
be there.
15 to 30,000.
Yeah, that's crazy.
Yeah.
Crazy expensive.
Now, Medicare will pay some of that, but it will never pay all of it.
Yeah, for sure. Like we have elderly
members.
parents right now, and we see a couple things. One, the nursing term is polypharmacy, meaning they take like 2 handfuls of pills several times a day. So I would like to avoid that because obviously there's costs associated with that. But then we also have people in our family that have cancer and they have Medicare and they've done well saving for retirement, but they're paying out a ton of money and they're having good outcomes so far. So we're happy about that. But they're paying out a ton of money out of pocket for their care. Yeah.
And it changes too, obviously, over time. We had one family member who had cancer and paid nothing out of pocket for his Keytruda treatment. But then we have another family member who's going through the very same treatment and they're paying $10,000 or I'm sorry, $2,000 every month just for that one treatment.
Yeah. And I think it's because she needs it longer than what the recommended course is. So anyway, I don't know. That's crazy.
So if we have these things, so I guess if I'm thinking about, I'm 47 years old, what age do these things start to come about?
Yeah, that's a good question. All right. So just kind of going down through some of these things that might affect you in that Jesse laid out the prices on. So for heart failure, the average age, and this is the US, but I'm sure like in Western countries, it's not completely dissimilar, although we lead the pack with some of these issues. But heart failure, the average age of onset of heart failure is 59 years old.
Wow.
So if you think about, for me, I'm 55. And, before I started this whole health and fitness journey that I'm on, my blood pressure was 177 over 110, and I had no symptoms at all. So I found it out incidentally in a physical for work. So I don't have that many more days or wake ups before I would have heart failure if I hadn't addressed that and done something. So it doesn't, and that's, if you're going to traditional retirement age, that's well before you would retire that you would be in heart failure. A heart attack, staying on the cardiac side, for males, the average age for a heart attack is 65 and a half, and for females, 72. So again, even if you're not retiring early, we're still talking, you're pretty young, right? And in some cases, you might not even be retired yet and you're having a heart attack already. So there's 2 significant heart related issues. Kidney disease itself, it becomes more prevalent over the age of 60. And then once you get to the age of 70 years old and older, you have a 50% chance of having one of the stages of kidney disease. So, and, they can be managed, medically all the way up until the point where you said the $50,000+ a year of dialysis. Nobody wants to go there. But if you have some of these other problems, that might unfortunately be the end result of it. And then finally, and this is one I think that everybody in Generation X should really be on the lookout for, quite honestly, is type 2 diabetes. The age range of onset for type 2 diabetes is typically between 45 and 64 years old. So we're right smack in the middle of that. And you're actually technically pre-diabetic, at least according to your last labs. Now, she has lost weight and she's been exercising. So it'll be interesting to see what her next physical says.
And that's coming up next month. So I'll have an update on that.
Yeah. So just like as I maybe have hopefully avoided heart failure, hopefully you're going to avoid diabetes.
I hope so.
That's the goal anyway. So that's kind of when these things happen. Let's talk a little bit about why they might happen. And you have some statistics on the rates of like obesity and people being overweight in the US.
Yeah, and one of the reasons that, or one of the contributing factors with my pre-diabetic piece of it was being overweight, as we said. So the statistics actually are staggering. For the US specifically, 30.7% of adults in the US are overweight.
Yep.
Overweight. And then another 42.4% are obese, some level of obesity. 9.2% of that 42.4% are severely obese.
Right.
So what that says to me, and I went to public school, but I teach homeschool, so I know my math. That means 72.4% of the United States adults are overweight or obese.
Yeah, that's crazy.
Insane to me. And I'm part of that.
Yeah. And so, like, anecdotally, we have this story from our recent trip to Disney World. Why don't you share that with?
Yeah. So our son and I were at the pool. He kept going down the slide and everything at this place. And, looking around, I didn't really think too much, but then like he kept looking over at this one area, kept staring. And I thought, oh, please stop staring, whatever you're looking at, and you were trying to be like, like I want to look, but,
Yeah.
Anyway, so I'm sitting there and I notice he's not the only one staring. There's other people too. And what I recognized was there's this family of like 6 or 7 people. And I mean, from the parents, and the parents were probably, I'm guessing maybe in their 60s, early 60s. And they had like 20-year-old children with them, obviously a family, but they were all really in shape. Like they looked fantastic, had like beach bodies. They had the great bathing suits and they were sporting them. They looked phenomenal. And I realized they're the only ones here who are in shape, who are like look normal. Or I should say that should be normal, right? But it wasn't.
Yeah.
The normal was overweight Jessie and her friends who were also overweight. Well, not my friends, but you know what I mean.
Yeah, that's crazy. It's like being like healthy now is like you're a unicorn almost, Yeah. It's nuts. So So we've talked about, some of the costs associated. We've talked about some of the bad things that can happen, cancer, diabetes, et cetera. And there is a correlation between your weight and all of these chronic illnesses. There's something called metabolic syndrome. And so metabolic syndrome it's like a group of things that you have that contribute to your ability to have diabetes, heart disease, stroke, et cetera. And they are your waist circumference. So the larger your waist circumference, the worse off you are. Your triglyceride and your HDL cholesterol levels, elevated blood pressure, and then finally your fasting blood sugar, like if it's elevated above 100. So if you unfortunately hit all of the abnormal ranges in those 4 categories, then you have what we call metabolic syndrome, and you're highly at risk for all of those things. And it's almost like a self-licking ice cream cone, because it's like, do you have diabetes because you're overweight? Are you overweight because you have diabetes? And why did your kidneys fail? Is it because of your high blood pressure? Why do you have high blood pressure? Because you're overweight. And it just like keeps going in this loop, and it's like you can't get out of it to some degree. And so I think one thing that I was kind of shocked with was the statistics on Generation X. So right now I'm 55, so I'm kind of in the older range of Gen X, and you would be more on the younger side of Gen X. 25 to 30% of us already have metabolic syndrome. And the problem with metabolic syndrome is your risk for it goes up as you age. So if we're already there, like, do we think that we're really going to have these healthy lifestyles that we're maybe watching some of the older people? Like in our family, we have people in their 80s and 90s. And they're having health issues, but they're in their 80s and 90s, and up until now, they've had pretty productive lives. I don't know that in our generation, we're going to be able to do that if we don't get out in front of some of this stuff. So I think it's important to talk about some of the potential ways to prevent this.
So can I ask you this?
Yes.
I mentioned dementia.
Yes.
Costing almost $49,000.
Yes.
Per person per year. I believe I am at risk for dementia just hereditarily.
Yep.
Right?
Yep.
So we didn't really talk about that much.
Because it doesn't really relate to the metabolic syndrome thing, but there is interesting data on dementia that's important, I think, because it is a high healthcare cost. And I didn't mention the age ranges, but let me mention this real quick. Okay, so for dementia, it's more common when you're over the age of 65. I guess the good news is the average onset is 83.7 years old. So,
Okay.
it's not something that's going to hit you as early as heart failure for the most part. But here's kind of where dementia prevention and some of these other things that we're talking about kind of like come together a little bit. There was a study in 2022 in the American bleh,
Medical.
Medical Association neurology study. It looked at 78,000 people over 7 years. And what they found is that people in this group that walked 10,000 steps a day or more were 51% less likely to be diagnosed with dementia than people who were basically sedentary in that group, in that study group. So it's almost as if it's saying like walking is medicine, right? I mean, if you could take an inexpensive generic pill that had no side effects and it would reduce your chances of dementia by 50%, why wouldn't you do that, right? Especially if you're at risk. So all of this comes back to, I think, and with regard to prevention, is what we've been preaching here for a while now is 3 steps, right? And we got to start them now because we're not getting any younger. So it's move more, eat better, and lift heavy things. And once again, the 10,000 steps comes up again in the literature, and I'm sticking by that. And I know there's some competing studies out there and whatnot, and people can like argue about, well, there's this one that says 7,500 is the best. Here's the thing with 10,000. It's just enough that it takes effort to do it. Unless you work in an Amazon factory and you're like walking constantly. But for the average person, it's going to take some effort to do. But it's not like running a marathon every day. So you walk 10,000 steps. What is that going to do? It's going to get you out of the chair more often. It's going to get you off the couch more often.
10,000 steps, I owe it for weight loss. Big time.
Same. I mean, hugely, especially if you look back on all my videos, for sure. And then I say, do not diet. Don't do keto. Don't do carnivore. Don't do Whole30. Don't do any of those because statistically, you're going to fail. You'll do it for a short period of time, and then you'll quit. And it's happened to both of us. So our thing is just eat better incrementally over time. And it's funny because you notice if you've been doing it long enough, and now I've been doing it a little bit longer than you, but not a ton longer. But all of a sudden, all those things that you used to do aren't as important anymore. Like it's not as important to eat a Reese cup or ice cream as much as it used to be.
Right.
In the very beginning, it feels like, holy cow, I'm restricting myself. But you get used to it and it's fine.
You replace it with other things.
And
if you have to.
And I don't let myself get hungry, at least not on purpose. I mean, I do. Everybody gets hungry sometimes, but like I eat what I want. I don't count calories and I don't get crazy about portion sizes. I just try to eat good food. And then finally, strength training. And I think the reason for strength training is we know we lose muscle mass as we age and we want to be mobile. So one of the things we didn't talk about is falls and fall risks, but I see a lot in the emergency department, mobility issues with people as they age. I can tell you if you're overweight, that's going to be a problem. Then you get older, that's going to be a problem. And we did a video on knees. If you haven't checked that out, you might check that out. If you ever have knee pain, we have some answers on why you might have knee pain as well as what you can do about it. So here's how you can do it. You can literally reduce these, what could be monster costs for healthcare and retirement just by taking care of yourself a little bit better. And now. And the benefit is you'll feel better. But the crazy part to me is this. Monetarily, when we talk about saving for retirement, a lot of people do that very early. But they put this off. Well, they always say with regard to saving for retirement, the best time to save for retirement is 20 years ago. The second best time to save for retirement is today. And I always say the same thing with weight loss and health and fitness. The best time to have started would have been 20 years ago when we were in our 30s. And we were to some degree. We just, the 40s and early 50s kind of let things go. But the second best time is today. So I guess that's our message to you right now is start today. Do something to reduce your healthcare costs that's totally free and you're in complete control over. Thanks for watching.
Thanks for watching.